Assalamualaikum and salam sejahtera to the respected panels and judges of IICCE 2021. My name is Syaira Ashiki binti Alias from School of Electrical Engineering, University Teknologi Malaysia Alam. Today, I would like to present our project which entitled Internet of Things Based Heart Failure Monitoring System using Radio Frequency Identification. Before I present our project, I would like to share some figures and numbers based on statistics made by Department of Statistics Malaysia in 2020. It shows that the first ranking of principal causes of death in Malaysia with 15% is due to ischemic heart disease, whereby 16% elderly people aged of 60 years and above died due to this disease. Hence, it is important for this group of age to get monitored on their health condition, especially during the pandemic crisis. Therefore, this research and development will be focused on developing an IoT system that be able to monitor the patient with heart failure disease. Besides, this system is intended to carry out monitoring process without having patient to present at hospital during the pandemic. It is a development of wireless medical sensors that connect to Arduino and Blink apps via Wi-Fi. Real-time data can be monitored using smartphone, and if any abnormality of health condition occur, an alert notification will be sent to the doctor for medical consultation. As we know, nowadays people suffer from various kinds of disease and health problems, mainly for those with chronic heart failure, especially among the elderly people. Based on the statistic information stated previously, it is also the main reason the hospital admission, particularly for elderly people, increases throughout the year. Hospital staff are burdened to serve multiple patients, especially during the time of pandemic crisis. Adults of any age with certain underlying medical condition such as cancer, diabetes mellitus, and heart failure are at increased risk for severe illness from coronavirus disease. Therefore, it is important for this group of people to be protected by limiting their interaction and avoiding crowded places such as hospitals. Hence, this project aims to develop an IoT system which can monitor the health condition of patients with heart failure using Arduino, RFID, and mobile application. Next is to design a system that is able to monitor vital signs of heart failure symptoms. And lastly is to develop a graphical user interface of the mobile application which can store and update the patient health data history. The components used in developing the heart failure monitoring system were illustrated in block diagram form, while the following slides show the prototype design of the system. Besides, Blink application is also used to provide graphical user interface for ease of user to interpret the measurement of health data. And now, do enjoy watching the prototype simulation video. As a conclusion, this project development presents remote health monitoring approaches with integration of RFID technology, Arduino, and mobile application in monitoring patients specifically with heart failure disease. The authorized professional healthcare can simply assess and monitor their patient health record using smartphone. Through this development, the implementation of remote health monitoring in healthcare sector would be beneficial for both patient and doctors. The burden of medical staff can be minimized with the decrease in number of patients that they need to handle during the time of pandemic crisis. Besides, social interaction for patients at increased risk of exposure to COVID-19 to get consultation without physically present to the hospital. This system also could save patient life as it is intended for early detection of heart failure symptoms. As for commercial potential, the COVID-19 has increased the demand for monitoring devices at home and reduced frequent visits to hospitals. The situation has also changed consumer behavior, purchasing, and demand pattern. Besides, the COVID-19 pandemic has brought the need to harness and leverage digital infrastructure for remote patient monitoring, where the reduction in medical expenditure is encouraging more patients to option for this system rather than the conventional method. That is all for my presentation. In following slide, we will find the information regarding the academic and intellectual property recognition for this project. Thank you.